Neovascular glaucoma is a serious complication of diabetes mellitus that occurs as a result of proliferative diabetic retinopathy. This disease is characterized by the formation of new abnormal blood vessels in the structure of the eye, which can lead to increased intraocular pressure and damage to the optic nerve. Factors contributing to the development of neovascular glaucoma are long-term decompensation of diabetes mellitus, duration of diabetes mellitus for more than 10 to 15 years, removal of the affected lens in diabetics, especially the intracapsular cataract extraction procedure, surgical vitrectomy through the pars plana in connection with progressive diabetic retinopathy, arterial hypertension, periodic or persistent increase in blood pressure. The specific clinical picture of this disease includes the following signs: inevitable increase in intraocular pressure, narrowing of the field of visual perception, degeneration of the optic nerve, new, formed vessels are detected in the vitreous, fibrous tissue grows on the iris and in the angle of the anterior chamber. In some situations, the patient may not feel any discomfort. Most often, the disease is accompanied by the appearance of pain, symptoms of inflammation and redness, as well as possible deterioration of visual function. The following diagnostic methods are used to establish the presence of neovascular glaucoma: biomicroscopy, examination of the structures of the eye and intraocular media using a slit lamp, gonioscopy, a method of visual examination of the anterior chamber of the eye using a goniolens, gonioscopes, in combination with a slit lamp or operating microscope, ophthalmoscopy, examination of the fundus of the eyeball using an ophthalmoscope or fundus lens. Main approaches to the treatment of neovascular glaucoma in diabetes: intravitreal administration of drugs that block vascular endothelial growth factor, which is responsible for neovascularization. Their use helps to reduce newly formed vessels and reduce intraocular pressure. Laser coagulation of the retina, used to destroy ischemic areas of the retina that stimulate neovascularization. In the case of the last stages of the disease, the only effective method is glaucoma surgery. Vitrectomy. Removal of the vitreous body and pathological membranes can improve the condition of the retina and reduce the risk of further neovascularization. Transscleral cyclophotocoagulation. A procedure aimed at reducing the production of intraocular fluid by affecting the ciliary body, which helps control intraocular pressure. Drug therapy. The use of antihypertensive drops, such as beta blockers, carbonic anhydrase inhibitors, and osmotic diuretics, helps reduce intraocular pressure. Control of systemic factors. Effective management of blood glucose levels, blood pressure, and lipid profiles is critical to prevent the progression of diabetic complications. The most effective method of control is the timely identification and adequate treatment of those diseases that cause the occurrence of neovascular glaucoma.